let's go to mouthwashes. So what are mouthwashes? They are actually liquids which enhance your oral hygiene. But again, I'm going to stress, mouthwashes are not a replacement for brushing and flossing. मैंने आज माउथवॉश कर लिया, मैंने माउथवॉश यूज किया, इसलिए मैंने ब्रश और फ्लॉस नहीं किया. नो, माउथवॉश इज नॉट अ रिप्लेसमेंट, इट्स जस्ट एन एडजंक्ट टू योर ब्रशिंग एंड फ्लॉसिंग. ओके, एडिशनल है ये ब्रशिंग और फ्लॉसिंग से, और थोड़ा एडिशन अगर आपको अच्छा, इफ यू वांट अ गुड ब्रेथ and if you want to prevent gum disease, so this is just additional to your brushing and flossing. Okay, so just like toothpaste, we have different kinds of mouthwashes. I will just be talking about two kind of mouthwashes. One is the antiseptic mouthwashes and the other is the fluoride mouthwashes. So antiseptic mouthwashes, they have chlorhexidine gluconate as their main ingredient. Okay, and these kill the bacteria. So these help, these can be used by people who have bad breath, who have gum diseases, and who have oral ulcers or mouth sores. They can use these kind of mouthwashes. Also, people who have infections can use this. Next comes the fluoride mouthwashes. As the name suggests, these mouthwashes have fluoride in them. Okay, and like I told you, fluoride prevents tooth decay. It protects the tooth enamel. So fluoride is helpful in preventing tooth decay, and so is the fluoride mouthwashes. So people who are more prone to getting cavities can use fluoride mouthwashes, right? So how do you use a mouthwash? See, take a cap full of the mouthwash, okay, or a cup that may be provided along with the product, okay, या फिर उसका ढक्कन जो है उतना ही माउथवॉश लो ढक्कन भर का. If you feel it is too concentrated, अगर आपको लगा ये बहुत strong है, तो उसको डाइल्यूट करो सेम एक कप, एक कैप फुल ऑफ वाटर में. ओके, सो द प्रोपोर्शन शुड बी 1:1. जितना माउथवॉश लोगे उतना ही पानी लेना है. ओके, डाइल्यूट इट, पुट इट इनटू योर माउथ एंड स्विश इट अराउंड योर माउथ फॉर 30 सेकेंड्स. ओके, 30 सेकेंड तक उसको मुंह में घुमाना है. आफ्टर 30 सेकेंड्स स्पिट इट आउट. डू नॉट स्वॉलो इट और इंजेस्ट इट. नाउ रिमेंबर, after using a mouthwash, do not eat or drink for 30 minutes. 30 मिनट तक ना कुछ खाना है, पीना है, ना ही माउथ वॉश करना है, रिंस करना है पानी से. Okay, let the ingredients of the mouthwash remain over the tooth. Okay, so this is how you're going to be using mouthwash. So I told you so many advantages of mouthwash. See, although it has the advantage of preventing gum disease and freshening up the bad breath and so soothing the mouth sores and preventing all kinds of infections, still if you use it for a very long period of time, the disadvantages will outweigh the advantages. That means you should not use mouthwash for a very long period of time. So what are the disadvantages? See, these antiseptic mouthwashes, okay, what they do is they're antibacterial. That means they kill the bacteria. So when they're killing the bacteria, they don't see ये good है या bad है, ये good bacteria है या bad bacteria है. They don't see that. Generally वो सारे bacteria को kill कर देंगे. Okay. So along with bad bacteria, they're going to kill the good bacteria as well. And then the balance gets disturbed. And once the good bacteria number decreases, then your immunity decreases and you will have a lot of other infections. You would be more prone to having such infections. So that's why do not use a mouthwash for very long period of time. Okay. Secondly, some alcohol based mouthwashes, what do? They actually cause dehydration of the mouth and therefore you may have dryness of the mouth. Chlorhexidine containing mouthwashes, that is the antiseptic mouthwashes, they, if you use them for a prolonged period of time, they will cause stains or discoloration of the teeth. This is a very major disadvantage if you use the mouthwash for a long period of time. I have patients who keep coming with stains over their teeth and they do not have any other habits. They brush their teeth properly, they floss their teeth properly. Their tea, coffee intake is not in limited amounts, and there's no other way of, there are no other signs or of any other systemic disease that is causing stains. And then when I questioned them, and then we realized that they use a lot of mouthwashes over a continuous period of time. Okay, so these chlorhexidine based toothpaste, they cause staining or discoloration of teeth. So I'm saying that you shouldn't use it for a long period of time. So how much time should you use it? You can use a mouthwash say for 25 to 30 days, okay, at the max. After that, put a pause it, and again reuse it, give a break of say 25 to 30 days, and again restart using it. So उसको continuously use मत करना, 25 to 30 days या 20-25 दिन का gap दे दो, and then again reuse it. Okay, so do not use it continuously. So having said all this about mouthwashes, I would like to stress that people who are using mouthwashes to mask their bad breath, okay, it's like you're spraying perfume over a very stinky body. Okay, so instead of doing that, it's best you visit your dentist, find the root cause of your bad breath, get it treated rather than just masking it with your mouthwash. That's really not the right way to do it. Okay, so please visit your dentist if you are having a bad breath. So this was all about mouthwashes. Okay,